The key processes that are necessary to build out a more effective and efficient hiring and onboarding process include updated, detailed job descriptions, first and foremost, that clearly outline the essential services of that job role and the key skills and experience needed for success in that role. The administrative systems and staff to navigate the hiring process need to be current and robust. And then having succinct interview questions to identify technical and soft skills, as well as interpersonal competencies and preferences, are extremely important. Also, having easily understood onboarding and training materials is really key for those new staff to really understand what they need to do for the job and to hit the ground running well starting on day one. The hiring agency should have designated staff outlined prior to recruiting in order to supervise and train new staff and ensure that they have all the equipment needed to perform the job ahead of time. Knowing the processes for hiring both state employees and contractual staff is critical, as those will often differ through a public health agency such as ours. Having a robust partnership with your HR team and with any contractual hiring vendor is really a must. First step is really taking the time to prepare and to review job descriptions. That does take a little bit of time, but it's really worth it to make sure that we're getting the best qualified candidates in those roles. A well-written job description can save a lot of time and confusion when recruiting so that you and the applicants can identify the appropriate skill sets that are really needed to perform the job up front. It helps to revise existing job descriptions whenever possible so that you can avoid starting from scratch in making those and then save a lot of time. Also, having a clear idea in your mind already of what makes the ideal candidate for that role, and then assess candidates as they apply rather than all on the back end at one time, which can take more time in total. Scheduling interviews as soon as you identify a suitable candidate and prepare your interview questions in advance as candidates are applying. Make sure that you have those questions ready so that when interviews are scheduled, you just have them available for you and for your interview team. Decide the best candidate within a business day. If you can, and make sure that you, with your team, have a decision where different folks have input. Following the completion of all of the interviews, submit your candidate into the hiring process quickly. And while steps are being completed for the hire, ensure that the onboarding process, staff, and equipment are ready well in advance of the start date for that new staff member. During a governor-declared emergency like the COVID pandemic, hiring and financial processes are streamlined, which allows for more rapid hiring and onboarding. And that was something that was very helpful for us during the COVID-19 pandemic staffing scale-up. Essentially, we're competing with other states and partners for the same candidates or prospective staff, so that can be a little bit of a challenge. Salary structures for different agencies may be different. The folks who are doing the hiring and onboarding often are working full-time jobs themselves in a response, so there can be some time challenges for those folks. To onboard, to train, and to navigate the hiring process. Sometimes you may have some challenges with the lack of equipment being ready on time when you have folks onboarding and starting their first day. Again, making sure that that's available is really critical. Sometimes we've had some attrition with newly hired expanded staff due to incompatibility with the job role, that maybe folks just didn't clearly understand at the beginning what that job was going to entail. So making sure to flesh that out in the interview very carefully is really important. For us here at the Indiana Department of Health, we've also experienced some challenges with remote work policies that might differ with different agencies and among state employees versus contractual staff. We've had some differences in remote work policies. So strategies we used here at the Indiana Department of Health to address these challenges, especially in regard to different salary structures, included emphasizing the unique opportunities to work here at the Indiana Department of Health and the total compensation package that we offer state employees versus just simply the salary. Making sure that when we're hiring for state positions, that we really make sure folks understand the state benefits of working in these job roles, that it's not just salary. Informing staff as they onboard of wellness support, including employee assistance programs for state staff, the availability of debriefings, therapy dogs that we use during our COVID response, providing access to other wellness resources outside of employee assistance programs such as Be Well Indiana, so that even our contractual employees have access to wellness support. So we identify staff at the very beginning, before we ever start the process for hiring additional staff. We identify our own internal staff right away who will supervise and onboard these new staff expeditiously. And we scope out our onboarding processes well ahead of time so that new staff can effectively integrate into our existing teams from day one. New staff are linked with experienced supervisors who thoroughly know our systems and processes. Some of them have several years of experience working here at the Indiana Department of Health and can effectively coach new staff, which is extremely important so that they feel welcomed, they're quickly introduced to their teammates, they're oriented to their workspace and their equipment. Supervisors frequently check in with new staff to answer questions, allay concerns, and ensure that they're getting the appropriate training. Be also able to receive feedback and ideas from these new staff and how they can better integrate with our teams as well. Yes, so to monitor our impact of recruitment and onboarding, we carefully monitor retention of the staff that we've hired and how effectively new staff are learning their roles by looking at job performance, by those check-in meetings that we have with them. Supervisors conduct one-on-one meetings with new staff members and also convene team meetings to assess how effectively work is being performed, any need for additional training, answer questions from new staff, and again, hear feedback and ideas. Division directors here at the Indiana Department of Health, as well as our HR team for state employees, conduct exit interviews with any staff member, both contract and state employee, who leave IDOH employment for any reason, and then share that information back with supervisors so that we have a feedback loop. If or when folks leave, we understand the reasons that they're leaving. We also, again, monitor that retention rate and make sure that we're also monitoring performance so that we can spot any pitfalls quickly, address any concerns, answer questions, provide additional training, and make the experience better overall. So first off, as we mentioned, robust partnerships with your human resources team as well as contractual staffing vendors are really key, including some non-traditional staffing partners like CDC Foundation. Being open to those new opportunities and finding out more about them and using them whenever you can is really important to help you scale up quickly. Anticipating what your staffing needs might be in a response, ahead of a response if you can. Make that part of your after-action review. Staffing should always be part of that review to see what went well, what you want to improve, what you've learned for the future in regards to staffing. Creating well-written job descriptions, again, and interview questions. Sharing interview questions ahead of time with your interview team and assembling that team as soon as the job is posted so that you can quickly schedule those interviews and make sure that you have everyone at the table that you need. Evaluating applicants quickly to interview, and then conducting those interviews and evaluating your candidates for who might be the best fit for the role promptly is really important so that you don't get behind. Ensure that your interview team or your staffing team is ready to effectively onboard and train new staff, and that they thoroughly understand, and the part of new staff thoroughly understand the expectations of their role. Supervisors should be mindful of new staff's questions, concerns, or challenges and address them promptly, including referring new staff to supportive resources if necessary. And then again, anytime staff do leave, find out reasons why. If those are reasons that relate to processes or the job itself, being able to quickly implement improvements is very key.